Hey there, parents. Today, I'm here to talk about something that no parent ever wants to face, but many do: asthma in babies. It can be a terrifying experience, but don't worry, I've got you covered with some essential information on why it happens and how to treat it. First things first, what exactly is asthma? Asthma is a chronic lung condition that inflames and narrows the airways, making it difficult to breathe. Symptoms can include coughing, wheezing, shortness of breath, and chest tightness. These can be particularly distressing in infants who can't communicate what they're feeling. So, why does asthma happen in babies? There are several factors that can contribute. Genetics play a significant role. If you or your partner have asthma, there's a higher chance your baby might develop it too. Environmental factors are also crucial. Exposure to allergens like dust mites, pet dander, and even secondhand smoke can trigger asthma symptoms. Respiratory infections and a family history of allergies can also increase the risk. Now let's get into the remedies and treatments. The most important step is to consult with your pediatrician. They might recommend a few things. First, medication. There are quick relief medications for sudden symptoms and long-term control medications to manage chronic symptoms. Your pediatrician will guide you on what's best for your baby. Secondly, keeping your home environment clean can make a huge difference. Make sure to vacuum regularly, use air purifiers, and keep pets out of your baby's sleeping area. Wash bedding frequently in hot water to kill dust mites. Another crucial remedy is to avoid exposure to tobacco smoke. If you or anyone in the household smokes, it's vital to quit or smoke outside far away from your baby. Tobacco smoke can significantly worsen asthma symptoms. Nutrition can also play a role. Breastfeeding has been shown to reduce the risk of developing asthma. If breastfeeding isn't an option, don't worry. Just ensure your baby gets a balanced diet as they grow, rich in fruits, vegetables, and whole grains. And lastly, always have an asthma action plan. This is a personalized plan developed with your pediatrician that outlines how to manage asthma on a daily basis and what to do during an asthma attack. Remember, while asthma can be a serious condition, with the right care and management, your baby can lead a healthy and active life. Stay informed, stay vigilant, and most importantly, stay positive. You've got this. Thanks for watching, and don't forget to like and subscribe for more helpful parenting tips. Take care.